And good afternoon, everybody. Thank you for joining us today. My name is Nick Ward. I'm the director for the Center of Health and Safety Culture. Our center focuses on the cultural and social factors behind our choices of engaging in healthy or unhealthy behaviors. And recently we've been doing some research to understand what social factors, what cultural factors might be leading people to choose to drive after consuming cannabis. It's a topical issue, especially as different regions are changing the laws regarding access to cannabis. It's also a fairly controversial topic given the difficulties of measuring the risk factor around cannabis and driving. And there are certainly other factors which are of a greater risk, such as drunk driving, but as more regions are changing their laws, and it seems to be that more people are engaging in cannabis use as a result, this is going to be a growing issue as we move forward in trying to achieve our traffic safety goals. So to get ahead of this curve, we've begun doing some research to understand what our culture is around the use of cannabis and its relationship to our decisions to drive after using cannabis. And today we'll be talking about a couple of research projects that we've done to start the discussion about what some of these cultural factors might be which are leading to the decision for some people to engage in driving after using cannabis. The agenda today, we'll start with a background not only about the center and the work that we do, but also some background on driving under the influence of cannabis, DUIC, as a risk factor. Then we'll move into discussing two research projects that we've been involved with. The first was a roadside survey of drivers in Washington State, and the second was a larger national survey of traffic safety culture in relation to DUIC that was conducted as part of a pool fund project that we're involved with. And then we'll wrap up, hopefully leaving enough time for some questions and discussions at the end. Next slide. Just some housekeeping issues. We're hoping this will be an interactive discussion. I'm sure there's going to be lots of questions out there in the audience. We'd like to invite you, because of the large number of attendees, so far we've got about 100 people, asking questions over the phone won't be feasible. So instead, we'd like you to type your questions in the box provided on the webinar interface. You can type in questions at any time, but we're going to save time at the end of the webinar to answer those questions. So we'll go through the research first, and then we'll spend time at the end to answer the questions you have. Second point is we are recording this webinar so that it will be available for access after today. That will be made available on our center website, which you see in the third bullet. So to help us with the quality of the audio recording, we'd ask you all to please keep your phone muted while you're on the webinar, and to keep the webinar itself muted so that the only communication we have with you is through the typed question box at the bottom right of your interface. Next slide, please. With that, we'll move on to the first agenda item, which is an overview of our center and an overview of the DUIC as a risk factor. And to lead us with that background, we're going to have our principal scientist at our center, Jay Otto, talk. Over to you, Jay.
Thanks, Nick. Thanks, everyone, for joining us. I just want to give a little bit of background about the center and some aspects of cannabis before we get into the research projects. So we're an interdisciplinary center. We involve a variety of different fields. We seek to serve communities and organizations and move beyond just research. All of our research that we do is applied. It's in partnership with communities doing projects to move the needle on very specific behaviors. We also think it's very important that we bring what we learn out to the field. So we engage in training and guidance at the community, state, and some federal projects to help build capacity of communities to engage in improving health and safety. Here's a quick map of where we have done projects in the past and where some of our current projects are. As I mentioned, we do some federal projects, a number of state projects, and some community-level projects. Those can be counties or municipalities. While this topic today is about traffic safety, we also work and have done a lot of work in the substance abuse arena. That certainly overlaps with this issue today. We're also getting more and more involved with efforts around violence and child well-being. All of you probably know these issues overlap, and collectively they're sort of the top 4 issues if we sort of look at overall well-being, and certainly if we look at years of potential life lost and issues like that in terms of public health. Today, we're going to be looking through the lens of traffic safety culture, and we want to spend a minute just to ground this definition of traffic safety culture. The word culture has lots of different meanings to lots of different folks, and certainly in academic circles, there are many different ways to define culture. We are not claiming that one definition is better or right or wrong, but this is the definition that we're operating from. And looking at it through the lens of the values and beliefs that are shared among groups of road users and stakeholders, and in particular those that influence their decisions to behave or act in ways that affect traffic safety. Clearly from this definition, we do not include actually behavior directly in what we call culture. We recognize culture as influencing behavior. We also aren't putting artifacts of behavior in this definition. We're intentionally keeping that out. And that is because we recognize, we view traffic safety culture as something that we can modify and influence to impact behaviors and artifacts. So clearly values and beliefs are very important. We look at this through the lens of a cognitive approach. These are kinds of thoughts. And so what you're going to see today is where we've started to examine some of those values and beliefs in the context of driving under the influence of cannabis. We are looking at those that are shared, not to say that everybody has the same values and beliefs, but we are looking through the lens of starting to see what most people believe. And when we look at a notion or a group where most people have a share, a value, or a belief, then we're starting to think about that as being a part of that group's culture. And clearly, there are many different groups. We can think of groups in some traditional ways in terms of males and females, young adults, older adults. We can also think about groups of different kinds of road users. So that could be, recognizing the culture of motorcyclists may be different than traditional vehicle operators or non-motorized users of roadways. So there are lots of different groups. We can also recognize groups by geography, residents in a state or a region of the country, or rural versus urban. So lots of different groups, and their cultures will largely overlap, but we also know that they're unique and different in some ways. So there are certainly many dimensions to this idea of culture, and also recognizing that it's not just road users we're focusing on, but stakeholders. And that stakeholders could involve all of you who may be involved with improving health and safety or traffic safety on our roadways. Stakeholders may also involve law enforcement, elected officials, DOTs, all sorts of different stakeholders. So the definition is very broad and does involve many different dimensions. In order to determine and sort of focus what values and beliefs we want to examine as impacting traffic safety, we use an augmented integrated behavioral model. This is one that's really a synthesis of several different behavioral models from the research. And this allows us to help narrow and understand and identify which beliefs we want to focus on, because clearly not all beliefs influence an individual's behavior, and we want to start to be more systematic in identifying those beliefs which do. So we're not going to go through in great detail all of these boxes, although some of the survey work that we've done seeks to measure each of these. Right now, what I'd like to do is just spend a little bit of time and focus a little bit of background on these three, we call them three broad buckets: behavioral beliefs, normative beliefs, and control beliefs, as they really start to inform and capture the big chunks of the different kinds of beliefs that we explore in these surveys. So behavioral beliefs our expectations about engaging in a behavior, and they inform attitudes. And we often look at that as sort of through the lens of sort of what's in it for me if I was to engage in this behavior. So, for example, around exercise, I might have a belief that if I exercise, I will feel better. That's a positive expectancy of engaging in the behavior. We can certainly also have negative expectancies, like, I don't like getting all sweaty when I exercise. For any given behavior, we'll have usually a large number of behavioral beliefs, some positive, some negative. We start to weigh those and maybe weigh them differently in different conditions and start to develop an attitude about a behavior, and that will partially influence to what degree we engage in that behavior. Another set of beliefs are normative beliefs, and these are in relationships to other people. Behavioral beliefs are about our belief about the behavior. Normative beliefs are our beliefs in the context of others. And it's about what our perceptions of what is expected and common about the behavior. And we'll differentiate these in two classes: an injunctive normative belief. For example, my doctor might expect me to exercise. My spouse might expect me to exercise. It could be different groups who expect me to engage or not engage in a certain behavior, and those are called injunctive norms. We also have that group of our sense of what is common or typical, and those are called descriptive norms, and so it's most people like me exercise regularly. And both of these kinds of beliefs, injunctive and descriptive, will start to inform our sense of perceived norms, and this is yet another set of beliefs that will influence our behaviors, and they'll influence our engagement in behaviors differently in different contexts. And then a third set of beliefs are called control beliefs. These are our sense of our ability to engage or not engage in a behavior. So this includes many different factors. It might include our knowledge. It might include our ability or our sense of whether we can or can't do something based on, it could be based on laws, it could be based on rules, it could be based on whether we have the resources to do something. So, for example, I might say that if I wanted to, I could walk 20 minutes every day. We separate control beliefs as not whether I want to or not, but could I if I did. I might have a sense that, I'd like to do yoga as a form of exercise, but I don't know how. So in that sense, lacking the knowledge is an example of a control belief that would perhaps limit my ability to engage in a behavior. So we just wanted to quickly give you some background on these three broad buckets. We'll talk about some of the other components of the behavioral model, in particular when we talk about the second project. But just to give you a sense, when we look at traffic safety culture and this idea of shared beliefs and how beliefs influence behavior, we go back to a behavioral model to help us discern and find and discover which beliefs are the important ones for any given behavior. So now I want to shift gears a little bit and talk some background about driving under the influence of cannabis. Just in general, I think all of you know, which is why you're here, that we know that traffic crashes are a leading contributor to years of potential life loss. Traffic incidents are a significant public health issue. We know we've seen an uptick in fatal crashes in 2015, and unfortunately, I think it's looking like 2016 is even greater. But we all recognize that this is a very significant public health issue. When we start thinking specifically about driving under the influence of cannabis, and we use the abbreviation DUIC, it's very complicated. Assessing impairment due to cannabis is complex. We do not yet understand or have good measures to associate different levels of use with impairment. We also are still, as a field, internationally, I think still seeking the science to understand what biometric measures indicate levels of impairment or influence of cannabis on our system. So while we can measure some biometric components, those may or may not be directly related in the moment to impairment. And this is ongoing research, very complicated. This is not our expertise, but we have to look at that and understand how that complicates our understanding of the impact of driving under the influence of cannabis. Nonetheless, when we look at various meta-analyses done by other researchers that are often informed by a variety of mechanisms to assess cannabis use, sometimes it's just by self-report of individuals, when was the last time you used. Certainly some of the studies are starting to suggest a potential increase in crash risk. So here was some work from 9 studies showing an increased odds ratio up to 1.92 of the association between recent cannabis use and increased traffic crashes. In a meta-analysis of 66 studies, they were starting to see that the odds ratio again was exceeding and going up some. Moderately, certainly the research that is coming out, we're seeing at probably lower levels, let's say, compared to high doses of alcohol. But nonetheless, certainly the meta-analysis seemed to be indicating this increase in crash risk. There's also been work done trying to look at culpability or how does the use of DUIC associate with responsibility for a crash, and certainly seeing some of the research showing some association there. And this was work that was done, I believe, in France. So this is very much a topical issue around the globe. And we also see that when cannabis is combined with alcohol, we can see a combined effect that is often more than just cannabis by itself. We have pretty good knowledge in terms of alcohol, both in terms of how to measure it biometrically and its association with impairment. We're still obviously seeking to learn that on cannabis, but there's also this recognition that there can be both substances in the system at the same time, and that they may have a synergistic effect where the one is amplifying the other. We also recognize that driving under the influence of cannabis seems to be increasing. When we look at some of the roadside tests and compare prevalence of THC, we can see an increase from 2007 to the 13-14 round of roadside studies. Again, this is complicated because of the relationship between THC and impairment. It is complicated. But nonetheless, we seem to see more folks potentially on the road with THC in their system. And we also know that as legalization is occurring in other states, we're anticipating that overall use may be increasing among populations as well. So just to round out some of the thoughts as we look at this background, it is a very complex issue and very hard to assess. Some evidence which is aggregated from meta-analyses seems to be indicating an increase in crash risk, certainly in combination with other drugs like alcohol. And the notion that DUIC is increasing suggests certainly that as traffic safety professionals and others, we need to keep an eye on this, be learning about this and understanding this, so that we can really not get caught behind, especially as more states are exploring legalization. All right, so with that quick backdrop, what I'd like to do now is turn it back over to Nick, who's going to give us some overview of some analysis and work we did in partnership on a roadside survey.
Thank you, Jay. Yes, so we're going to start off with an overview of a project we did in collaboration with PIRE, Tara and John Lacey. Tara's now at NORC. They were involved with the roadside survey in Washington State, taking biometric samples from drivers to detect the presence of THC. And as part of that project, we overlay a survey trying to assess the cultural factors that are leading drivers to intend to engage in DUIC in the future. Next slide, please. So in essence, the assumption here is that people don't accidentally smoke marijuana and get in the car and drive. It's a deliberate choice, so we're trying to investigate what are the cultural predictors, the cultural factors that influence the intention to drive after using cannabis in the future. So what is the social influence of our culture, our traffic safety culture, on our decision to engage in DUIC? A secondary goal of this project was to develop a short form of a survey that could measure cultural factors around DUIC that was pragmatic and useful for administering or for collecting data roadside. So what was a short format for a survey that would still be valid but would be practical for field work? Next slide, please. So the method basically paralleled the standard roadside survey method that PIRA does periodically. Data was collected Friday during daytime and also weekend nighttime to get samples that reflected those time periods, and roadside sites were selected across Washington state to try and capture a representative sample of different types of road user and neighborhood, including urban, suburban, and rural counties. From the random selection of drivers on the road during those time periods, commercial drivers and emergency vehicle drivers were excluded, as were non-English speakers. During the data collection, vehicles were randomly stopped or approached while they were stopped at a light or a sign near the data collection site and invited to participate in the study. And if they agreed, they pulled over, usually to a safe spot, such as a parking lot, where the various data collection was taking place. And there was a large range of data collection methods involved, including taking saliva and blood samples, as well as collecting a number of survey instruments, including the one that we developed for this particular study. The police were present on site for the safety of the team and road users, but did not interact with either. And subjects who agreed to participate were paid for their participation in the study for some of the data collection methods, including saliva and blood samples, but the survey that we developed and that was completed at the roadside was an unpaid volunteer activity. Next slide, please. So we created a survey for this study based on the model that Jay described to you. And this is the sort of the template for the survey that we used. You'll see the items here listed in white and the particular aspect of the model that that item was intended to measure in yellow. So the actual intention item, I do intend to drive after using cannabis in the next 6 months. So that was our measure for future intention, and that was what we were trying to predict based on the other questions in the survey. So as you scan down, you'll recognize from our model a number of the boxes in that model that we were measuring. So, for example, measuring value, to what extent do people value traffic safety or safety in general, we have these two items here. My own health and safety are important to me. The health and safety of all road users is important to me. A behavioral belief, using cannabis does impair driving ability, so that's a belief about the consequence of cannabis use on one's own behavior. We had a number of attitudes measured in here. Driving after using cannabis is enjoyable. Driving after using cannabis is unwise. Both of those are measured as attitudes, sort of a sense of emotional reaction to or perception of utility of a particular behavior. These are derived from our behavioral beliefs. We had a measure of perceived control. It is my own decision to use or not use cannabis. And the second one, I'm able to refuse to use cannabis. We then had a number of items to measure what is called a prototype image. That is the attributes that we perceive the typical person who engages the behavior as having. Those can be positive or negative attitudes. So people who drive after using cannabis are cool, and people who drive after using cannabis are stupid. We had another behavioral belief. I would be arrested if I drove after using cannabis. We had a couple of norms. One, injunctive. People who are important to me would be disappointed if I drove after using cannabis. and a descriptive norm, I think most people who use cannabis drive after using it. And if we finished off with another behavioral belief, I would cause a crash if I drove after using cannabis. So you can see we've tried to measure with one or more items each box in our underlying model of how traffic safety culture influences intention to engage in risky behavior, in this case, driving under the influence of cannabis. A couple of notes about this particular survey that we developed. It's what's called a binary forced choice format. Each respondent was asked to simply say yes or no to the statement. Survey items were written as a statement about the person, and they had to say yes or no to it. So that's a very quick response format for them to do. You'll notice, too, looking at the far right columns, we not only asked about how they would respond, which measuring overall people would be a measure of actual culture in this sample, we also asked respondents to say what they thought most other people would say, what most other drivers would say. And by most here, we mean more than 50% of other drivers. What do people who responded to the survey think most other drivers would say? And that gives us a measure of what the perceived culture is. Because we had a very short time period to get this survey completed, we did exclude some items from the overall model, so we don't have normative or control beliefs in here. Our target was to try and get this survey to be completed in less than 2 minutes, and it seems that that was successful. It's a fairly quick survey for people to complete, and so it was convenient for use while people were sitting in their car completing a roadside survey. And we also collected some additional demographic data, which we'll talk about in a bit, such as age, gender, and whether or not the person had a medical card for marijuana use. Next slide, please. Okay, here we go. So our sample, there were 720 drivers that were approached during the sampling period. Of those, 697 agreed to participate in the overall study. And of those, 432 agreed to complete the survey we developed, which was unpaid. And here's some of the summary data for the demographics for the 432 people who completed our survey. You can see fairly balanced in terms of both age and gender. Small group of medical card users, but as we'll see in a bit, having a medical card did influence how people reported certain cultural variables and the influence of those cultural variables on their intention to drive under the influence of cannabis. You'll see from this sample there was a rather large subsample of people who did admit to driving under the influence of cannabis in the past. So that's interesting to note. This is Washington State, where there's different laws in other states, so that might be one reason why the past reporting of DUIC was quite high in this particular sample. Next slide, please. So first to start with, here is a summary of responses to how drivers responded about their own self. This is the actual cultural items. So for example, I do intend to drive after using cannabis in the next 6 months. 89% said no, they did not intend to do so, whereas 11% said they did have the future intention to drive after using cannabis in the next 6 months. And what this graph or what this table has tried to show, the shaded boxes are the boxes that one might normally consider to be a positive or a good culture, a safe culture around cannabis and driving. So for example, going back to question 1, the no box, the no cell is highlighted because saying no, not having an intention to DUIC, is the safer response. And the bold numbers are what the majority of the sample said, again, above 50%. So going back to the first example, most people in the sample had the safe response of saying no, not having an intention to drive after using cannabis in the next 6 months. So looking at where the bold and the shaded cells line up, it is somewhat comforting to see that primarily we have a positive culture, a safe culture regarding DUIC. There are a couple of exceptions to that, of course. Next slide. If we look at item 13, I think most people who use cannabis drive after using it. This is what drivers think. This is a descriptive norm. It's interesting to note that most of our sample, 65% of our sample, think that most people who drive after using cannabis drive. So there is a perception that the norm here is for cannabis users to drive after using it. And that may or may not be true, but there's certainly a strong norm in this sample that it's perceived to be normal for cannabis users to drive after using it. Next slide. One thing to note here again is that only 11% of road users report the future intention, and this brings up the interesting discussion of how one perceives these results. So for example, going from a sort of a cultural frame, having 89% of the sample saying they do not have the intention to drive after using cannabis, from a cultural lens, that's a good result, that's a positive result. The culture that we're measuring here is primarily a safe one because the vast majority do not intend to drive after using cannabis. So it does seem from a cultural lens to be a strong, positive, safe culture in the sample. However, instead of that lens, taking a public health perspective, the fact that 11% of the sample do intend to drive after using cannabis in the next 6 months, that is a concern from a public health point of view because although arguably fairly small at 11%, that 11% could do a lot of harm to themselves and others. So we need to look at these results with both lenses, the cultural lens and the public health lens. Yes, generally speaking, the culture is positive and safe, but from a public health perspective, there's still a sizable subsample which do intend to engage in risky behavior that could cause harm to themselves and other road users. Next slide, please. This new table actually shows what our sample thought most other drivers would do. So this is what they perceive other drivers to be saying. Next slide. And what's interesting here, going back to what we were just discussing, 11% of drivers said they have the future intention of driving after using cannabis in the next 6 months. But when you ask them what they think other drivers would say, they tend to overestimate what other people are saying. They're overestimating other people's intention. So whereas only 11% of drivers reported that they themselves have the future intention to DUIC, nearly a third of the sample assumed that most other drivers say they do have the intention. So there's a misperception here amongst our sample that most other drivers do have that intention. Next slide, please. Moving on to what cultural factors predict future intention to drive after using cannabis. Here's a table showing our results. We used binary logistic regression to see which of the cultural variables, the survey items that measured our boxes in our model, which of those predicted saying yes to having the future intention to drive after using cannabis. And these were the 3 items from our survey which had significant predictive value, and what we're reporting here is a relative risk. And the first one I want to talk about is driving after using cannabis is enjoyable. This is results for actual culture, what drivers said themselves. So those drivers who said, yes, driving after using cannabis is enjoyable, were nearly 4 times more likely to report future intention to drive after using cannabis than not reporting such intention. So the cultural variable of perceiving driving after using cannabis as being enjoyable was a significant risk factor because it predicted an increased likelihood that those individuals have the future intention of driving after using cannabis. The other two factors, using cannabis does impair driving ability, and people who are important to me, the first one being a behavioral belief and the last one being an adjunctive norm, both those were protective factors. Drivers who thought cannabis impaired their driving ability and drivers who thought people important to them would be disappointed if they engaged in DUIC, both were less likely to engage in driving under the influence of cannabis. So we have two protective factors, believing that cannabis impairs and believing that important people will be disappointed. Both of those are protective in the sense that they reduce the chance that someone would report future intention, whereas the attitude that driving after using cannabis is enjoyable, that increases the likelihood of someone saying they would have the intention to engage in DUIC in the future. Next slide, please. We also had some interesting interactions in how these cultural factors predicted intention, depending on whether or not the person said they had a medical card or not. And the first graph here is the interaction between the belief of being arrested and having a medical card or not. And what it shows is believing that you would be arrested, believing that you were not going to be arrested, so not having the belief that you would be arrested, really increased the proportion of people who intended to DUIC if they had a medical card. Said differently, whereas people who didn't have a medical card, not believing they would be arrested, did not have much of an impact on their intention to DUIC. But those people who did have a medical card, if they also believed they would not be arrested, they had a much higher probability of intending to drive with DUIC. So the combination of having a medical card and not believing they would be arrested really increased the probability of an individual reporting future DUIC intention. Next slide, please. Another interesting interaction was that between those who did or did not have a medical card and what they perceived to be normal in terms of thinking most other people do engage in driving under the influence of cannabis. So here we see the combination of having a medical card and thinking most other people who use cannabis drive afterwards. That combination strongly increased future intention to engage in DUIC. If there was no medical card, the perception that most other road users who consume cannabis also drive afterwards did not have such a large impact on intention. It was a combination of a medical card and the perception that most other cannabis users do drive afterwards that really increased the probability of reporting future intention. Next slide, please. So what can we summarize from this initial roadside survey of drivers in Washington State? First, it was apparent that there was a significant amount of reported past DUIC behavior. More than 40% of our sample of roadside drivers in Washington State admitted that they had engaged in DUIC in the past. It's also apparent that the sample of drivers surveyed at the roadside had a very strong normative perception that most cannabis users do drive afterwards. There was a sizable amount of individual drivers who reported their own future intention to drive after using cannabis, about 11%, which from a cultural perspective says the majority have a safe, are safe in the sense they don't have that intention. But from a public health perspective, 11% having this future intention could pose a significant problem in terms of traffic safety. There was a misperception, just like there was with the normative perception. There was a large misperception that most other drivers do intend to drive after using cannabis in the future. So generally speaking, this sample does think that DUIC is normal and that most other drivers do intend to engage in DUIC in the future. In terms of what variables predicted DUIC intention increased if the drivers thought that behavior was enjoyable, and it decreased if drivers recognized that cannabis impairs performance and that behavior would disappoint people that were important to them. We also showed some interesting interactions with the data reported by people with medical cards. So it may be that there is a subculture with respect to medical card holders and DUIC. Next slide, please. So what are the conclusions here? Well, the majority, if you look at the overall results, one could argue that, generally speaking, the culture is rather safe and positive, but there is a sizable subsample that do engage in this particular behavior and have the intentions to engage in this particular behavior that can be a significant public health issue. By looking at this data in a structured way, using the model that Jay outlined, identifying which cultural factors influence the intention to engage in DUIC behavior, we can use these results to start thinking about the kinds of strategies that should reduce that intention. So, for example, if the perception that driving after using cannabis is enjoyable is a significant predictor of future intention, what kind of strategies can we develop that would reduce that perception of enjoyment? Similarly, if the belief that cannabis impairs driving reduces the risk of future intention, how can we best communicate that cannabis does impair driving performance? And lastly, if the perception that other people who are important or disappointed is something that reduces people's future intention, how do we remind people of those people who are important to them that would be disappointed? So that's just 3 examples of how we can use some of the results to start thinking about types of strategies that should reduce future intention to DUIC. And the last conclusion is it may be worthwhile considering metal card users as a different subculture and explore those more closely to see what kind of strategies might work with them, given that they're using marijuana for medical purposes rather than purely recreational purposes. And with that, I will stop.
All right, thanks, Nick. So that was a relatively quick review of one survey that we wanted to talk about today, the roadside survey. Now I'd like to shift and talk about a different survey, a larger one, and then we'll conclude all that we're going to share and open it up for questions. You can also feel free to type in questions on the little question box as we're going. Nick and I and other staff members can see those, and either I'll try to answer as we're going or others will try to answer as well. So the next survey project we want to talk about was a much larger project. It's a larger survey, and it was sponsored by the Traffic Safety Culture Pooled Fund. For those of you in the transportation field, you may be familiar with these. For those outside of the transportation field, it's a pretty cool method whereby departments of transportation across the country and other agencies who are interested can join together and leverage their research dollars on larger scale projects. So we recognize that sometimes doing cultural work is sort of a bigger and a new arena. And so it made sense to start a pooled fund. And the pooled fund is managed by Sue Sillick at the Montana Department of Transportation. And you can see the current participating states that have joined. And by joining as a state, you have a voice in guiding what kind of research is done and how potentially those results could be used or shared with others. So if you are interested in participating in the pooled fund, you can absolutely email Sue Sillick or contact Montana Department of Transportation. Her information is right there on the screen, and she can give you more information about how an agency can join and help guide some of this research. So this is just an example of one project that the pooled fund has sponsored. So again, we wanted to look at the work through the lens of traffic safety culture and explore what values and beliefs were shared amongst road users around DUIC. So we use that behavioral model to start to explore and understand the beliefs. And the particular research questions we were seeking to understand was, how does traffic safety culture compare between users and non-users of cannabis? How do those shared beliefs correlate with the decision to drive under the influence of cannabis? And to what degree we could assess how does the culture compare between states with and without legalized recreational use laws. So these are the three research questions we wanted to explore in the project. We used the behavioral model to help us develop questions. This was a much longer survey. The one that Nick just went over was specifically designed to be done very quickly roadside. This was going to be done more traditional methods, so we were able to use more questions and longer questions. So first, let's talk about how we define driving under the influence of cannabis. This is complicated in and of itself. And we elected to use a measure which other researchers have used. It's I think, what we would consider a conservative measure, but we defined it as driving within 4 hours of using cannabis. And we or marijuana, and we specified use as being any kind of use. It could be smoking, vaping, edibles, drinks, anything. And we used a 12-month look-back period. And this broad 4 hours of using, within 4 hours of using, you know, it is highly dependent. If somebody just smokes a small amount, it will hit their system relatively quickly. And, you know, it dissipates depending upon the intensity and how much they do it. If somebody eats something that has marijuana in it, the time at which it goes into their system could be delayed. It depends on what else is in their stomach and things like that. So it's a very complicated issue in terms of assessing and sort of self-reported behavior. So we elected to use this. Others have used this. We're not claiming that this is the best measure or perfect measure, but this was the measure that we used to assess DUIC behavior. We then looked at their willingness to engage in driving under the influence of cannabis, and we looked at it under 6 different circumstances so that we could sort of see how did the circumstance influence whether they were willing or not. So we used drive in an emergency, drive home on side streets, on the highway, even if you don't feel high, even though you still do feel high, and driving when you had also been drinking. And this gave us a scale to look at willingness across a variety of circumstances. We also looked at just their general intention. So thinking of the next 12 months, how often do you intend to drive? Whether it's viewed as an intentional behavior or whether it's viewed as something that just sort of comes up. We also wanted to explore that. Largely, we used, as you'll see, willingness as our predictor in the various models. Attitudes, we use semantic differentials to assess how they felt about driving under the influence of cannabis. We used 5 adjective pairs. Some of these, as you can see, sort of came off of similar to what was done in the other survey. Here we were able to add some more. So this was giving us their sense of some attitudes. We originally developed these from some interviews that we had done with individuals who use cannabis regularly, And then we did some pilot testing surveys where we started with a very large number of different adjective pairs, and we narrowed it down so that it was a little bit more time effective for the survey. Behavioral beliefs. We looked at 6 behavioral beliefs. We developed these based on the interviews as well. As you can see, 3 of them have a positive attribution and 3 of them have a negative expectancy. So we wanted just to have some of both, and that gave us insight as well, and we'll look at how those were associated with attitudes. We looked at perceived norms, both injunctive and descriptive. With injunctive perceived norms, we looked at a variety of social relationships. So we looked at what would their friends think, family members, their employer, law enforcement, and most people in my community, so that we could see how their expectations varied by social relationship. With the descriptive norm, it was very straightforward. We simply asked, how often do most people like you? And then a second question was, most people in your community drive within 4 hours of using marijuana. So we could get a sense from those 2 referent groups what they thought was typical behavior. When we looked at perceived control, we wanted to see perceived control around driving under the influence of cannabis is a little bit complicated. It's obviously not something that you have to have knowledge to do. You're almost sort of looking at it through the lens of how do I control maybe not to do it. But we wanted to look at were there circumstances that were likely to increase someone's willingness or just behavior. And so these also came from the interviews. So we looked at, how likely are you to find yourself in a situation having recently used marijuana that you then needed to drive, for example, drive to work or school, driving to run errands, or perhaps driving home after using marijuana when out or at a party. So we just looked at these 3 circumstances and how this might influence their sense of control as to engaging in the behavior. We used 2 methods to gather survey responses. We used a mailed methodology as well as an internet-based survey. We did, with the mailed survey, a higher intensive sampling in Colorado and Washington. The survey was done in the very first couple of months of 2016, so relatively recently. We selected 1,600 random households. They were provided a $2 cash incentive. We used a 4-contact mailing, an initial letter, a survey, a follow-up postcard, a follow-up survey. We also did a similar mailed survey of all other states. We excluded Alaska, Oregon, and Washington, D.C. These were 3 jurisdictions that had just recently passed legalization of recreational marijuana, but they were in very early phases of implementation, and we considered them to sort of be ambiguous. We didn't consider them necessarily to be a recreational legal state because it had just passed and some of them had not it wasn't being actually implemented yet. So we elected just to exclude those 3 states from the larger sample. We selected 1,600 random households across that broader population, same $2 cash incentive. Because mailed surveys tend to sometimes have lower response rates and even undersample young adults because of the way the addresses are selected. Sometimes young adults don't have as much billing history, which is often how the mail selects them. We also used an internet protocol. This is a purchase panel. We work with Qualtrics, which is a survey provider. They help identify purchase panels. We specifically wanted to focus on the younger age group. We looked at 18 to 30-year-olds, and we looked at, again, those same states excluding Alaska, Oregon, and Washington. We then did intense sampling in Colorado and Washington, and for that in particular, we screened them on 30-day use of cannabis because we really wanted to make sure we knew we really wanted to study people who are using cannabis. So we restricted that 4th group to 30-day users. So they had to indicate that they had used cannabis in the past 30 days. We had about a 32% response rate on the mailed survey. Overall, we had slightly higher response rates by females than males. The population was slightly more educated, higher education levels than the U.S. Census demographics. We did some corrections for gender and age to balance it with the census. So we feel pretty good in terms of the distributions and comparing it to the general populations. We also saw similar use rates among individuals reporting cannabis use as compared to the National Survey on Drug Use, the NSDUH. So those all made us feel pretty good about the sample. We developed scales using a variety of the items that we asked, looked at the internal reliability. Overall, the internal reliability was pretty strong on all the different scales. And then, as you'll see, we did analysis based on the different scales that were developed. So throughout, we'll report on 3 different surveys: the mailed survey, the internet survey of everybody excluding Colorado and Washington, and the internet survey of Colorado and Washington who were 30-day users. So this last group is always among individuals who use cannabis. The mailed survey, as we sort of anticipated, did not have a great response rate among young adults, 18 to 20-year-olds. So we excluded the few that did respond. So we're really looking at those age 21 and older among the mailed on the mailed survey. All right, so we wanted to look at first just the prevalence of driving under the influence of cannabis. Amongst the 3 surveys, the broad question, thinking back over the past 12 months, how often did you drive within 4 hours of using marijuana? Somewhat similar to what Nick was just reporting on the roadside survey. On the mailed survey, we saw about 9 out of 10 indicating that they had never driven, and about 1 out of 10 indicating that they had. On the internet survey of younger folks, that was about 85% reporting that they had never, and about 15% reporting that they had. And you can see the distributions in terms of how often. And amongst the third group, now this is all among users of cannabis, we saw about half, slightly more than half, indicating that they had driven within 4 hours, slightly less than half saying never. So we can start to see in general what are some of the self-reported behaviors around driving under the influence of cannabis. We, of course, know that you don't drive under the influence of cannabis if you don't use cannabis. So we also wanted to look at just what was the prevalence of driving under the influence of cannabis among past year users. And here we can see a slightly more than 40% from the mailed survey indicating that they had driven in the past 12 months. Amongst the younger population, slightly younger population, it was closer to about half, and slightly more than half among the sample that we drew from just Colorado and Washington, just looking at users. So these last 2 are somewhat comparable in terms of populations, and we're seeing somewhat comparable behaviors there. So overall, we are seeing that this is a behavior that folks are engaging in for sure. It's not a rare behavior. We were also somewhat concerned, sort of social desirability. Would people be not answering? Well, a lot of people told us that they certainly were driving after using cannabis. So then what we wanted to do was look back and look at the relationship between beliefs and self-reported behavior. So we looked at Spearman partial correlation coefficients. That's a robust technique to use with non-parametric data. And we also had other questions on the survey. We knew, for example, you don't really drive under the influence of cannabis if you don't drive. So we looked at driving frequency and how that influenced their driving under the influence of cannabis behavior. Also, how often do you use marijuana, the willingness scale. And then we also know that sometimes control beliefs can directly influence behavior and can sort of circumvent willingness. So you can see here that a number of those variables were significantly correlated to driving under the influence of behavior. We can note that willingness was the strongest one, but certainly others coming into bear as well, as we would expect. But it gives us a good indication that our willingness scale is an important one for us to explore and understand how then various beliefs start to influence willingness. And of course, you know, these other ones we probably in any kind of intervention, we're not directly trying to reduce driving or things like that. So then we explored similarly the partial correlation coefficients between each of the scales and willingness. And what we could see was that the attitude scale, all three had a relationship. The descriptive norm was kind of low. I'll talk a little bit about that. But the attitude scale was strongly correlated with willingness. Injunctive norms were as well, less than attitude, but still significant. And control beliefs were very important. We'll see in a moment, descriptive norms were not strongly correlated. This sometimes occurs with descriptive norms because actually everybody's descriptive norms were off. And so they're all perceiving that a lot of other people are driving under the influence of cannabis. So those norms don't vary very much analytically, so they don't show high on a correlation. But as we look in a moment, you'll see how they vary amongst those who are driving and those who are not, and what influence that might have. So this led us to believe from these analyses that we had some good measures here that would start to help us inform and better understand willingness, and thus allow us to develop a deeper understanding. In other words, the values and beliefs that we were examining were related to willingness and the behavior. We weren't measuring values and beliefs that were totally unrelated or irrelevant. So the next kind of analysis that we want to share here is just some graphical analysis that helps us see some patterns. We divided the respondents into three groups based on their self-reported behavior. So we wanted to look at the group of the people who did not indicate using cannabis in the past year. Then we wanted to look at the group who had used cannabis in the past year but did not drive under the influence of cannabis. And then the group who had used cannabis in the past year and did drive under the influence of cannabis. So three groups. We then, you'll see the graphs, we compare their beliefs by examining the means or the averages of the responses. The width of the box is the 95% confidence interval, so it gives us a sense of how confident we are about the mean. The means, you know, a reduction of the data. It's just the average, so we know there's some people who were above or below the mean, but it gives us a sense of what was the average response for that group, and then we can compare these three groups. So if we look at the components of the behavioral model, at the top we can see behavior, that's driving under the influence of cannabis, and as the groups were defined, the light box is no past year use of cannabis. The gray box is past year use but no DUIC. So both of those for DUIC behavior are all the way at the lowest end of the scale because they told us they didn't drive under the influence of cannabis. And then the black is people who indicated they had driven under the influence of cannabis. And of course, they are not at the lowest level, but you can see they average here on a scale of 1 to 7 at about a 5. We then can look at each of the beliefs, what we're defining as traffic safety culture, the different beliefs of these three groups, and how they start to vary. So as predicted, willingness significantly varies among the three groups. There's a much higher degree of willingness among those who drive under the influence of cannabis than those who don't use cannabis, and those who use but don't drive under the influence of cannabis is much lower. In general, the scales are moving from left to right. Right is more risk, which is why it's labeled as a redder color, and on the left is less risk. When we look at the attitudes are very different among those three groups. The injunctive norms are very different. The descriptive norms are different as well, but you can see the descriptive norms are all sort of inflated. They're all up higher, which is also why when we look at correlations, sometimes the descriptive norms don't correlate as much because actually sort of everybody's descriptive norm is a bit inflated. We also see that their control beliefs vary amongst the three groups. Now we'll dive into deeper in each of these different components to help make more meaning of it. So when we looked at attitude, as we mentioned, we looked at 5 semantic differentials. At the top is the composite of the attitude. Here we've made green being a protective attitude and red being a risky attitude. And the middle is sort of a neutral attitude. So the individual was asked to pick on a scale of 1 to 7 whether they thought driving under the influence of driving after using marijuana is, more uncool or cool, and this is the average where they responded. So you can see that on coolness, the folks who are doing it don't particularly see it as per se cool, but they see it as more cool than the other two groups. What's interesting here is when you look at danger and safety, those who are driving under the influence of cannabis are reporting it as on the positive side of safety, as safe. So that's very different. That's something that we need to be informed about. The other folks are seeing it as potentially dangerous. When we look at stupid and sensible, we see a similar pattern, pleasant and unpleasant, and unacceptable and acceptable. So this starts to get a sense that those individuals who are driving under the influence of cannabis have very different attitudes and beliefs than those other groups, and really differentiating and perhaps aspects of where you're starting to establish a culture there. We can also see that there are differences between those who use and those who don't use, as we would expect. And so this just helps to develop our understanding of the attitudes and beliefs behind this behavior. Now, we can pare back from attitude and explore behavioral beliefs. So the theory goes that various behavioral beliefs inform our attitudes. So we can look at the relationship or the association between each behavioral belief and the attitude. So that we looked at the correlations. And as we recall, the first 3 behavioral beliefs are positive beliefs. So this showed that people who agreed with this first statement were much more likely to have a positive attitude about driving under the influence. Negative behavioral beliefs had a negative correlation. So the more I agreed with this statement, the less positive my attitude was. So it's negatively correlated. So what we can see from here is that a sense that I feel calmer was pretty strongly correlated with a positive attitude, and a sense that I will be more alert was strongly correlated with a positive attitude. To a less degree, my sense of that I would be cautious. Numerically, one of the lower ones was a sense that I would get arrested. So that's not dominating as the other behavioral beliefs are. For some, my reaction time will be slower. This became a somewhat strongly correlated one. And I'm more likely to be in a crash or an accident. So a sense of susceptibility is there. But we can definitely start to see that these behavioral beliefs are associated with the attitudes that they formed, and they align in terms of what we expect in terms of both positive and negative expectancies. Now, when we looked at the injunctive norms, we broke that down based on the 5 different groups that we explored. And we can see how then each of the 3 youth behavioral groups, how they perceive differently among these social groups. So those who drive under the influence of cannabis have a sense that their friends would think it was okay. So it's acceptable among their friends, whereas those who don't drive are less likely to think that, and those who don't use much even more, less even still. In general, all folks had a sense that their family would not agree. They're below 4, but those who drive under the influence, it was less of a disagreement. You can see how they view their employer. You can see how they view law enforcement, and then most people in their community. So this helps us to understand how they're perceiving what's acceptable to various relationships as we break it down by those different kinds of social relationships. When we looked at the descriptive norm, we looked at two referent groups, most people like you, and then just most people age 21 and older in your state. We can see again that when we look at it, most people like you, we get a better differentiation because, and that's very typical with descriptive norms. But when we look at most people in their state, a lot of people are perceiving, even those who don't use cannabis, that a lot of people are driving under the influence of cannabis. When in fact, overwhelmingly, most people do not drive under the influence of cannabis because in fact, most people don't use cannabis. But nonetheless, so we start to see how there are significant misperceptions around what is typical in terms of behavior, and we can see those misperceptions are greater amongst those who are engaging in driving under the influence of cannabis behavior. When we look at control beliefs, we wanted to look at how likely are you to find yourself in one of these situations. EU up here stands for extremely unlikely, and then unlikely, somewhat unlikely, neutral, somewhat likely, likely, and extremely likely. So we can see that amongst those who drive under the influence of cannabis, they're much more likely to find them in a situation where they need to drive to work or school. So it's using cannabis at a time where they then are recognizing I'm going to have to drive soon and go to a place like work or school. I may have to drive to run errands, and then amongst both groups, I may be having to go home after a party. So obviously this latter goes at social use, where use might be amongst a social setting and people are going home. But the first two settings are very much sort of a part of daily life. So it really helps us understand that as we start to explore this, we're going to have to understand driving under the influence of cannabis as occurring in a variety of situations, not just after a sort of a social setting. We also looked at values. For the values work, we use what's called the Short-Schwartz value survey. This is a relatively short three questions that we use. We look at 10 different broad values. We use an approach called the most least rank rate method. People rank what is my most important value, what is my least important value, and then they rate each of the 10 values subsequently. By asking them their most and their least first, you get a better spread when they then rate them. We then look at their ratings. How did they rate each of the 10 different values? Again, the spider lines associate with the three different groups, the same group we've been looking at. And as you can see, and the statistical comparison is between the DUIC group and the no past year use group. So that's what the statistical significance, it's just a paired t-test. We can see pretty significant differences on values of conformity, tradition, and security. So those who are using cannabis or driving under the influence of cannabis having lower evaluation of those three values, conformity, tradition, and security. When we look over here at enjoyment in life, stimulation, and self-direction, we can see that those who are using are stronger on those values. They're more dominant than those who are not using. And we can see it out a little bit more on the broad-mindedness as well. This becomes important, not so much that we're going to seek to change people's values in any kind of intervention, but it does help us recognize in an intervention how we might frame things and how we might talk about things, in that we are going to need to align with people's values who we're trying to reach. If we don't align with the values of the people that we're trying to reach, they may reject then our subsequent message. So we're going to have to acknowledge these folks have a high valuation of enjoyment, stimulation, self-direction, broad-mindedness. This will help give us some guidance as to then how we might frame and just acknowledge that there are different value systems going on there and how we might connect that. All right. So what were some of our conclusions? One, there are clearly some significant differences in beliefs. when we look across attitudes, behavioral beliefs, normative, and control between these three groups. That helped us see that these beliefs are interesting to explore, and that these groups are seeing things and believe things differently. We also we didn't show it here because of time, but we did the exact same analysis and comparison between states with and without recreational use laws. So we compared those responses from Washington and Oregon with the responses from all the other states, again, excluding Oregon, Alaska, and Washington, D.C., because they were in the intermediate legalization process. We found no significant differences in beliefs between states with or without recreational use. Now, we have to be very careful when we find no significant differences. That doesn't mean that differences don't exist. It just means we could not statistically measure them. That's just where we are. It might be in the future we start to see differences, or it might be with other measures, other mechanisms we would see differences. Our results, we could not discern any differences. We also examined differences between those states with medical recreational use law or medical use laws and non-medical use. We could not see differences there either. Overall, I'm not terribly surprised that we didn't see differences in beliefs. These laws are relatively new, and I'm not sure that we would anticipate to see significant differences in beliefs based on laws that have only been enacted for a few years. That's just my hypothesis. We could not discern any differences in the results that we examined. So some of the recommendations that we look at, we are going to need to, if we're seeking to influence driving under the influence of cannabis, we're going to have to really examine some of the beliefs. And in particular, there are beliefs amongst users of cannabis that they are feeling it is safer and in essence, better to drive under the influence of cannabis than not. So we're going to have to explore that. We're going to have to recognize that driving under the influence of cannabis can occur in a variety of settings. It's not just a social setting, coming home, the Friday or Saturday night, but it could be in a context of having to go to work or school or just run errands. We're going to want interventions to align with existing values so that we have a greater degree of connection and acknowledge some of those differences of values. There's a tremendous amount more research that we need to do to further understand these beliefs and, of course, the sources of these beliefs. We don't know from these results, where people develop these beliefs. There are a variety of mechanisms we can hypothesize. Clearly, personal experience is a factor, vicarious experience. But where are the sources of the beliefs coming from will be very important to understand as well. And then obviously a lot of continued research to understand crash risk and assessing impairment and, of course, interactions with alcohol. We did not explore on this survey driving under the influence of cannabis and alcohol because of just the complexity of the number of questions, and the survey would become very long. But we know that that behavior is out there, and we know from the research that that increases crash risk. So that's a whole other arena that we need to explore to understand that interaction and how alcohol then becomes a whole other variable, and what are our beliefs and attitudes when we add alcohol into the mix. We also very much want to acknowledge the limitations of the research. This is all based on self-reported data collected using surveys. The surveys were in English, so non-English speakers were excluded. Clearly, we have a pretty good sense that we had a good response from a variety of different populations. However, it doesn't give us an indication of what those who did not respond to the survey are believing or doing or thinking. The internet-based surveys are certainly biased towards those who have access to the internet. We also know that self-reported surveys can have biases around social desirability, although, as we said, we had a large number of people indicating that they had driven under the influence of cannabis, and our cannabis use rates were similar to what we were seeing with other surveys. We also know that this was a point-in-time survey. So while we can see an association between beliefs and behaviors, we cannot establish causation based on this survey. These only reveal correlations, and correlation is not the same as causation. We know that the behavioral models that we're basing the questions on have had an extensive amount of research showing and demonstrating causality, but these results here do not establish causality and are limited to that, to where we only recognize it as correlation. All right, so whirlwind tour. We now want to come back and open it up to questions. I think the best mechanism here is if folks continue to type them into the question box, we can start to see those, we can read those. Because with the number of folks on the phone, it can be hard to take them orally. So if you can type them in to your chat box or your question box, we can then start to recognize them there. Nick, you've had some chance to read the questions more than I have. Is there anything you want to jump in and respond to right away?
Yes, there was a particularly interesting question from Ed, who noted that there was a fairly high percentage of drivers in both surveys that reported past DUIC behavior, but the percentage reporting future intention was much lower. And sort of provokes the question, is there something, if you, for the moment, ignore some potential reporting biases, for example, it might be easier to admit past behavior than future behavior. Is there something going on with a certain group of people who have committed that behavior in the past but have somehow changed their mind about doing it in the future again? And can we learn something from that subgroup who no longer wish to engage in that behavior but have in the past? So that was an interesting question. We haven't looked at the data that way before, but I just thought it might be worth maybe, Jay, putting on the spot and speculating why there may be a lower future intention than a past reported behavior, at least for these two surveys that we've done so far.
Sure. I think, one, I think it is a very interesting question, and things we can go back and see what we can discern, exploring some of that to the degree that we can. I think that also we have to recognize that this is it's a complex behavior, and that it may not, the question about intention to drive under the influence of cannabis may not be the best predictor of future behavior, because it might be a behavior that comes up out of circumstance where we don't really intend to do it, but we just end up doing it. And that's why we did want to measure both intention and willingness. Willingness focused more on sort of, in a hypothetical situation, would you be willing to do this? Intention is very clearly, how do you intend to do this? Some behaviors are just much more intentional than others. For example, exercise, one doesn't sort of just stumble on to exercising. It tends to be a very intentional behavior. Whereas I think driving under the influence of cannabis, and in particular as we saw looking at some of the control beliefs, I think it tends to be circumstantial, in that somebody might be using and then it's sort of like, oh, I've got to go to work. I need to drive, or I've got to go to school, or I went to a party, maybe I didn't, think ahead and plan about whether I would use or not, but I ended up using, and now I've got to get home. And I think certainly when we look at the historically efforts to address driving under the influence of alcohol, part of some of the strategies have been to really teach people to plan ahead. So really think right now, if you're going to drink, how are you going to get home? What's going to be your plan? And building that capacity so that either they choose not to drink or they develop mechanisms where they don't drive. We just may be nowhere near there with driving under the influence of cannabis, and certainly that aligns with a sense amongst people who don't feel that it's dangerous, that it's safe. So they might not say, oh, I intend to drive under the influence of cannabis, but we certainly saw that their willingness was pretty high. But I think your question is a very good one. We can go back and explore that some more. But my initial uneducated gut reaction is that it also has to do with the difference in willingness and intention for a behavior like this. Any other questions or things? I know one question came up, and I'm not sure, Nick, if you responded to it. Do you recall when was the Washington roadside survey done?
That was done in June of last year.
June of 2015 or 16?
Yeah, about a year. 15, sorry. About a year after the law changed in Washington State.
So it was June of 2015 was when the Washington roadside survey was done.
Yep. I did send an email out to the entire group. If you have any more follow-up questions, I put my email up there. Perhaps after you had a chance to think about the vast amount of information that came across today, you may have some questions or comments, and we're certainly happy to keep up this conversation going forward if you have any more things to suggest or ask us.
Just while you're thinking about or typing in your questions, the full report will be available soon on the Traffic Safety Culture Pooled Fund website, which is hosted by, as I said, Montana Department of Transportation. So there's a link there that you can go to. We also, as a center, as we talked about at the beginning, we feel that training is very important. So we're always engaging in training activities. There will be some training coming up next fall, in the 2017. So you can check our website to keep up on that. We will be doing another webinar similar to this one. It'll probably be a little bit shorter on traffic safety citizenship, which was another project that was funded by the Pooled Fund. It's a very fascinating idea. How do we look at growing citizenship behaviors to improve traffic safety? And citizenship behaviors are loosely defined as pro-social behaviors by others. So like moving beyond just getting you to wear your seatbelt, but how do I get you to get somebody else to wear their seatbelt? That's coming up in February, and you can register online. At the bottom there, you can visit our website. We're also on Facebook and Twitter if you want to follow things as well. So one question came up. So a good one. You know, how do we think about doing intervention addressing beliefs and attitudes when there's a lot of educational information out there that perhaps challenges this or it leads people to believe very different thoughts. This is a challenging time and very complicated. So I think, in my opinion, we've got a situation where public policy is a little bit ahead of the science, and we still need to learn and understand how do we measure cannabis impairment, and how do we do that either by self-report or biometrically, and then how do we really understand crash risk better so that we can inform these. Certainly some of the data that we're seeing from meta-analysis is showing an association and a concern and cause for alarm, but we need more concrete science to be able to make that. And then the work is always challenging where we have to develop interventions that counter other people's thoughts. Interventions may be longer and require more education, and it's going to take quite a bit of time. Certainly, as somebody who looks at a lot of data like this often, I was pretty amazed to see the number of people who do have very positive attitudes about driving under the influence. So that is there's a lot of shifting that has to occur with some of those beliefs and attitudes with individuals who have a positive attitudes. So yes, repeating where you can get the full report, that's on the screen right now. It'll be available on our website as well, but it'll also definitely be available on the MDT's website. So that link right there at the top. As I mentioned, or as I think Nick maybe mentioned, we've recorded this. So you'll be able to get a copy of the recording, which you could then share with others to listen to, or you can listen to just snippets of it, whatever you want. That'll be available probably in just a couple of days on our website, so you can be able to access that. Is there an anticipated time frame in identifying a level for impairment or blood alcohol concentration? Yeah, so that's a question that's well beyond my expertise. Very complicated. I know globally people are exploring this. Nick, do you want to take a minute or two and talk about some of the work that's going on in the project with Yale?
Sure. what is the appropriate level of THC, like BAC, to signify impairment? That's still an unsolved problem. Some people call it the Holy Grail. There is a project currently about to start funded by NHTSA. The lead institution is Yale University. Our university has a small role to play in that, but essentially the purpose of this upcoming project, the long-term goal essentially is to come up with a way of detecting an unsafe level of THC, not so much by measuring the level of THC in the body, but trying to relate that to a level of impairment in some kind of roadside task that a driver might do, such as a simple reaction time task or something like that. So because it is so difficult to identify a level of THC in the blood that links to a specific level of impairment that would be deemed unsafe, like BAC 0.08, whereas there's still work going on to try and determine that. There are parallel efforts to try and come up with proxy tests of impairment, impairment to attention, for example, or behavioral impairment that could be used roadside to help officers determine if the driver is impaired by a drug such as cannabis. But it is a difficult question to answer because THC, as we know, when we try and measure the risk associated with cannabis, because THC is fat soluble, it stays in the system a lot longer than the impairment. So measuring purely based on THC isn't always a reliable indicator of the impairment the person may be experiencing, which is probably why these additional efforts to actually try and measure the impairment itself, regardless of the source, than trying to detect the presence of a particular drug itself. But this is all ongoing work that's obviously important.
Okay, thanks, Nick. Any other quick questions or comments, or we'll wrap things up? Well, we want to thank you very much for your time today. Stay connected with us, and feel free to reconnect with the recorded webinar if you want to share it with others. And hopefully you can rejoin us in the future about some other upcoming webinars in the Traffic Safety Citizenship one. So that's all I have, Nick. You have anything else?
No, I want to thank everybody for your enthusiastic participation. It was a great turnout. We hope you found the information informative, and you've got some links on the slide where you can eventually get a hold of these, this presentation and the report itself that Jay spoke about. So we hope we'll be in contact with you again. Please reach out if you have any questions.
Take care, everyone. Be safe.